to be in the national spotlight when it comes to the opioid crisis. And it's a top priority for Governor Mike DeWine and the state. Dr. Brad Lucas is here from Buckeye Health Plan to talk about prescription drug abuse and prevention. Good morning. Thanks for being here today.
Thank you.
So tell me why Buckeye Health Plan is really focused on this issue.
We've seen it as a problem for a number of years now. It didn't creep up on us. When we did identify it, we had a bunch of babies getting neonatal care higher than we'd ever had, and we realized there were a bunch of babies that had born with addictions, and we had not seen that in the past. So we started to look more and more into it. In Ohio, in the last full year of data that we have, if you look at deaths, we have the second most deaths in Ohio, the whole entire country.
Yeah, and we're talking like triple the national.
Yeah, triple. The amount of prescribed opioids, we have way too many prescribed opioids. Probably 22% of those deaths were directly tied to prescribed opioids, and they were probably underneath kind of the background of a lot of those deaths also.
Wow. So there's got to be an economic impact here, though.
Yeah. Surprisingly, it's like $6.5 billion to almost $9 billion that we spend in the state, which is almost equivalent to how much we spend on kids in school, from kindergarten to all through high school.
Wow.
So a lot of money.
Wow, and we could be using that, as you said, for other things, right? So are certain people more susceptible to addiction? Or
Boy, everybody's susceptible.
Yeah.
We think of genetics and we think of the environment, and if you have family members who've gone through addiction, then there's more likelihood. If you're in an environment where there's constant stress, where drugs are more available, there's that. But it is so addicting, and I know we hear that, but we still don't appreciate it. Everybody is at risk.
Right, and it's something that is probably hidden, you know, if families or somebody who's addicted is probably keeping that to themselves. So is there something that we can do, signs and symptoms, really things to look for?
I think be aware that there's no area, there's no community, there's no family that's safe. So always be aware. Physical signs are very non-specific, maybe confusion, restlessness, sleepy, nauseated, but it's really changes in behavior, not spending time with your friends, relationships getting worse, missing school, missing work, just not doing things that maybe somebody used to enjoy, just completely different. And then you have, if they're in a place where maybe they've needed to take some opioids for a medical problem, or where somebody might have said, hey, try this, it'll help you through your exams.
Sure.
You know, if somebody's in that situation also, then just be very suspicious. Yeah, be proactive and talk about it always.
What if you kind of notice maybe some of these symptoms, some of these signs? What can you do?
If you're an individual and you know that you're troubled and you're kind of losing all of your relationships, seek help from your doctor, ask to be referred to an addiction specialist, call your health plan. At Buckeye, we have all sorts of resources to connect people, to help, and we're always there for you. Sometimes when there's nobody else left, you know, when you call us, we'll pick up the phone and we'll be your friend. If you're a parent, get your child in to see the doctor and just be upfront with it.
Yeah, and talk about it, be open. Because it is, we don't want to see these deaths. And you have some background in OBGYN, so as you mentioned, you know, seeing some of these babies being born addicted.
We saw it and put a program into place so that we can be there to help our pregnant members when their doctors are concerned about addiction, when they're concerned about addiction, and it's somebody that's there to get them all connected. Nobody wants to be addicted to heroin or to opiates. It's not the plan. But it happens easily, and we can, you know, we're making strides, but it's tough.
It is, yeah, but as you said, just being aware, recognizing those things, and seeking that help, because there is help available.
There is.
Very good. All right, thank you so much for coming in today.
Thank you.
We appreciate it.